Hi, thank you for joining us today at our UCLA Health webinar series. Today we're going to be talking about treating congenital ear anomalies. My name is Justine Lee. I'm a craniofacial and pediatric plastic surgeon and the Bernard G. Sarnat Endowed Chair in the Division of Plastic and Reconstructive Surgery at UCLA. Please feel free to ask questions on Twitter using hashtag UCLAMDchat. So what are congenital ear anomalies? I think before we can start talking about what is an abnormal ear, we should start with talking about what is an actual normal ear. So here you see a typical normal ear, and what causes a person to look at an ear and see that it looks like an ear and it is an ear are a couple of features. One of the features are the convexities of the ear. The most common thing that everyone sees first is pretty much the helical rim or the helix that goes around the ear that makes one see the shape of an ear. The antihelix, which is a convexity that's in the middle of the ear that essentially protrudes out and also gives definition to the ear. The tragus and antitragus, these are two protrusions, two convexities that then show you sort of where the cheek ends and where the ear begins, as well as an opposing convexity called the antitragus that then just pretty much is facing the tragus. The lobule here, which is where most people wear their earrings, or most little girls wear earrings. The superior crus, this is on the top of the antihelix where we see a protrusion here, and its sister, the inferior crus, making a V-shaped type of contour here. Now, in addition to the convexities, there are also concavities of the ear. This concavity between the helical rim and the antihelix is called the scapha, so it's sort of like a little groove in between the two convexities there. Here, in between the superior crus and the inferior crus is another depression or concavity called the triangular fossa. And lastly, the concha here. This is a big concavity where everyone wears their earbuds or hearing aids. So in a congenital ear anomaly, any part of this ear can actually be abnormal. For the most part, these abnormalities don't really bother anyone, and a lot of people don't do much about it. But in some people, this can be very obvious and very disconcerting, or also just simply be a congenital malformation. So ear anomalies occur in about 5% or more of the population. It can be as mild as just a little fold or a little extra bump on the ear, and it can be a situation where it only affects the external ear. But sometimes it can also be associated with other anomalies, such as abnormalities of the jaw, the orbit, the hearing apparatus, nerves, muscles, and soft tissues. So, as you can see, ear anomalies occur in all different shapes and sizes. We've got one here where there's a little extra crus here. This is called the Stahl's ear. We've got one here where the helical rim is a little bit folded. This is a helical rim abnormality. You've got one here where the helical rim is essentially folded over like a lop ear, a little constricted ear abnormality. You've got our standard prominent ear that's very, very bothersome to a lot of kids and adults alike. Here's another mild Stahl's ear, another helical rim abnormality. And then you've got something that's a bit more severe. So up here what you see is a much smaller ear than what is normal. The top part of the ear is completely distorted. This child also has hearing problems where the ear canal is not developed. And then of course here this is a very, very undeveloped ear. There's no ear canal at all. So I get a lot of parents coming to my office and saying, or calling us on the phone and saying, I have a newborn, and my newborn has funny looking ears, and what should I do? Well, the step one for any medical condition is diagnosis. So see your pediatrician, see what he or she thinks, and ask for a referral to an American Board of Plastic Surgery certified pediatric plastic and craniofacial surgeon. And if you're not sure who is board certified, check the American Society of Plastic Surgeons website and find a surgeon on their website, which all surgeons are board certified. The next thing is to talk about your plastic surgeon about treatment options. Are there surgical options? Are there non-surgical options? So I'll start by introducing some non-surgical options that are really great options for babies. So non-surgical correction of an ear abnormality is called ear molding, and ear molding is exactly what it sounds like. It's molding the ear cartilages while the baby is young and while the cartilages are soft and easily mobile. So this can be done within the first couple of weeks of life, and usually as the baby gets older, the cartilages get harder, and it gets harder and harder to do, and the likelihood of success becomes a little low, meaning that the body has a tendency to want to go back to where it was before. And when the cartilages get harder, even if we try to mold it, sometimes it'll just go back to where it was. It'll stick back out again. Okay. This is a completely non-surgical process. There's no anesthesia involved. It's a low-risk process. And it involves just a couple of outpatient visits within a 6-week period, every other week, switching out the devices. So how do you know if your child is eligible for ear molding? Well, there's certain types of ear anomalies that are amenable to molding, and these are usually ear anomalies that are about the same size as a normal ear, but there's some distortions in the way that the ear looks. So I mentioned a couple of those ears on the panel where I showed all types of ear anomalies, and here we'll just kind of hone in on a couple of these anomalies that really can be molded. So a Stahl's ear, some parents call it a Spock ear, and that is basically when there's a little extra crease here where there's a little kind of bend that causes the ear to be a bit pointy. And this is something that can be very, very easily molded. This helical rim deformity, whenever there's a sort of like a contour abnormality of the helical rim, that's another one that works really well for ear molding. Prominent ear, so this type of ear that sticks out, that becomes really bothersome, hard for kids as they grow up in grade school, that's a great one to mold because this is really the only time you can do it in a non-surgical fashion. And of course, a lop ear, basically an ear that's folded over a little bit. This is a mild version of that. Cryptotia, this is an ear that looks like it's completely covered with skin, so it's kind of like a hidden ear, and that's also a great one to mold too. So what does ear molding look like? It's not a scary thing. It's a really simple little device, but it is a device that it covers the ear, and it kind of makes your child look like Princess Leia for a while. So I'll show you what it looks like on a silicone model ear. So here's a silicone standard baby looking type of ear, and this is what the device looks like when it's all put together. So what we do here is this part comes off, right? So we take that off, we put the device on the ear sits inside this little carriage, and these things here are retractors. So these things help mold the helix, the antihelix, the scapha here, and also the superior inferior crus if necessary. So these things then come on and essentially just kind of push on the ear here and here to reshape all of that. This is a conchal former or conchal former. This is here to mold the conchal area of the ear, so that kind of fits in right here. And then afterwards, the covering is snapped back on this device, and the device is left in place for 2 weeks. So pretty simple, and you see some air holes here, so there's air that freely comes in and out of the device. If you get a little water in it, it'll just evaporate. If the baby spits up, that happens a lot, it will not smell good, but it will evaporate. So it's a pretty simple device. And you can see it. It's a bit clear, so it's not completely transparent, but it's translucent, so you can see the baby's ear. I usually tell the parents, try not to get this area too wet because the adhesive gets a little bit loose and it tends to fall off. So what can ear molding do for your baby? Well, I mentioned prominent ear, so after 6 weeks of treatment, this is a typical result that we can get. So after molding, we go from an ear that kind of sticks out to an ear that looks pretty normal. And the Stahl's ear, a little bend right there. After 6 weeks, we're able to get that bend out here. And the helical rim deformity here, so the little concavity here, we're able to make it nice and round after 6 weeks of treatment. And same thing here, and a milder deformity, just a little bend here, and that's cleared up in 6 weeks. Again, helical rim, again fixed up in 6 weeks. So it's a very low-risk procedure again. Some of the things that you can expect with babies is that in the beginning, your baby's going to be a little fussy, not going to love it so much, but within a day or two, usually babies tend to get used to it. Sometimes you'll see some abrasions or tape allergy. Those are common things that babies sometimes have. Lastly, there are some babies that have a tendency of finding a way to take off these devices. So these are all those types of things that you can expect from ear molding. So let's move on to how about older kids and adults, because there are a lot of kids and adults who grow up with ear anomalies and they didn't have ear molding as a baby. And sometimes this is kind of a problem for them, meaning that they can feel self-conscious. A lot of kids sometimes grow their hair long to try to hide their ears. Sometimes they're bullied in school for their anomaly. Well, unfortunately for and all of these are really surgical. So, or surgical operation is called an otoplasty, and it's sometimes known as ear pinning. And it's known as ear pinning mainly because the most common reason we do this is for prominent ear, for ears that stick out. So what is an otoplasty or ear pinning? Well, it's a common procedure for older kids, teenagers, adults. It's a surgical procedure. It usually requires general anesthesia for the younger kids and teenagers. And for adults, you have a little bit more of a few more options in anesthesia. So even local anesthesia or sedation would be fine. It's an outpatient procedure that usually takes an hour. And the postoperative care requires staying away from contact sports for about 4 to 6 weeks. And really, like any type of motion that involves disrupting the sutures would be a problem. So even if it's not contact sports, sometimes people have accidents. They accidentally move their ears a bit early after surgery, and that's not usually the best idea. Okay. So the way we do an otoplasty is there is an incision on the back of the ear. It's pretty well hidden. You don't really see that after it's healed, but we make an incision there, and then we actually expose the cartilage on the backside. There are usually two problems. Again, I'm talking specifically for prominent ear because those are the most common reasons why we do an otoplasty. And the reasons for prominent ear is either the antihelical fold, so that groove or the scapha is not well defined, or the concha is a little bit farther away from the head, or the concha is a little bit too big. So after we dissect out the cartilages on the backside, what we do is we take some sutures to recreate the antihelical fold, or take some sutures to bring the concha a little bit closer to the skull. Sometimes, if the concha is really big, then we have to take out a piece of cartilage. So I say a lot of sometimes here because ears are just not the same. Nobody has exactly the same ear on one side versus the other. Nobody has the same ear as somebody else. And so because ears have so many variabilities, it sort of depends on what type of ear you or your child has for me to really tell you what really needs to be done. But this is the most common ways that methods that we use to fix these problems. And so what can otoplasty do for your child? So this is one of my patients. I believe she was about 10 years old when we did this, really having a lot of problems at school. And after an hour, we were able to get this result for her. That's long-lasting. It really doesn't revert back to the way it was before unless there's some type of accident, all right, like if the sutures get disrupted. Here's another kid, a little bit younger, same thing, another prominent ear deformity that we were able to bring a little bit closer to the head and cause him a little bit less distress. Okay, so we talked mainly about external ears so far, but ears are here for hearing. So is it possible that there would be any hearing problems? Well, yes, it's very possible. And that usually occurs when the ear anomalies are due to an underdevelopment of the ear. And this underdevelopment is called microtia. And this is usually associated to hearing loss because it's not just the outside ear that's affected, but also the inside ear, also the lack of an ear canal. So what is microtia? Well, it looks something like this. It's a real spectrum. You can be something, you can have an ear that looks a little bit like this, where the size is maybe a little bit smaller than normal, but looks relatively normal, to something that's smaller than normal and looks abnormal, to something that's looks like a little peanut, to no ear at all. So it's really quite a spectrum. So this is, of course, a much more severe, and we can pretty much guess that these two cases, there is no ear canal, and whereas these two may or may not have an ear canal. It occurs in about 1 in 5,600 people. So it's a little bit different than your run-of-the-mill ear anomaly. This is actually a congenital craniofacial condition. It's on the rare side, but there's a higher incidence in Latinos and Asians. And frequently, just like the kids up here, the ear canal is not developed, leading to frequent severe hearing problems. So if you think your baby has microtia, well, what should you do? Again, just as any medical condition, you need a diagnosis. So first, you want to know if there's a functional problem. So get a hearing test, or check the results of the newborn hearing screening. If your baby passed a newborn hearing screening, then they're probably going to be okay from the functional aspect. Head over to your pediatrician, ask him or her what they think about the ear anomaly, and ask for a referral to an American Board of Plastic Surgery certified pediatric plastic and craniofacial surgeon. Next, you can talk to your plastic surgeon about treatment options. So when a kid has microtia, I always recommend that they really need to be seen by a multidisciplinary craniofacial team. So a craniofacial team usually exists in many of the large academic centers like UCLA, and it includes people like me, a craniofacial surgeon, a geneticist, a pediatrician, an otolaryngologist, speech and swallow pathologist, an audiologist, pediatric ophthalmologist, pediatric dentistry, pediatric orthodontics, and social work. So there's a huge team of specialists that will then see your child and give you a combined recommendation from all the specialists on what your child needs. And this is really important when we're talking about craniofacial anomalies that are beyond just the external ear, just shape issues. Okay? And if hearing is a problem, definitely get a hearing aid ASAP. Reconstruction for microtia is completely surgical. There are no non-surgical options for this. So why do I keep emphasizing hearing? Why is it so important? Well, when kids have an underdeveloped ear like microtia, 90% of them have hearing loss. And much of this hearing loss can be corrected with a hearing aid. And this is incredibly important for speech and language development, for educational success of your child, and also for psychosocial well-being. So let's talk about ear reconstruction for microtia. So what is it? Well, it's recreating the external ear for kids who are born with underdeveloped ears or without ears. And it can be carried out anytime after 5 years of age, depending on the growth of the child. So sometimes kids are a little bit on the smaller side, and I'll tell them that we should probably wait a couple of years before starting this. Or if a kid is really growing fast, sometimes we can start it a little bit earlier too. I think the youngest I've done is about 4 or something, but of course it's, the kid was really big. It requires harvesting rib cartilages and carving the cartilage into an ear construct. And it's usually done in 1 to 2 major surgeries. Each surgery is spaced at least 6 months apart. So most parents will try to time this with school schedules or sports schedules. That's really important because we need the kids to stay away from school for about 4 to 6 weeks after each surgery. And this type of procedure has been done in both kids as well as teenagers as well as adults. So it's never too late to have microtia surgery. And what can ear reconstruction do for your child? Well, this is a patient of mine who, at 19 years old, realized that she could actually change her ear. So she was born with an ear that looks like this. On top, very severely malformed cartilages. On bottom, looks a bit more normal, But in a one-stage procedure, we're able to open up this ear, get rid of some of this abnormal cartilages, and get her an ear that looks a lot like normal. And so she's real happy now, and 19 years later finally has a normal ear that she's not hiding with her hair anymore. This is a little different from the first patient. This is probably my youngest patient. I think we did her probably around 4, almost 5-ish. A little bit less severe than the last patient, basically just this top area that's abnormal. And we were able to open this up again in one procedure for her to help her have a bit of a normal ear. One thing I'll point out is this is a hearing aid that she's been wearing because she actually has no canal on this side also. Even though it looks like she might, she actually doesn't, and she has severe hearing loss. So in summary, treating congenital ear anomalies has a few things that one should always think about. First, see an American Board of Plastic Surgery certified pediatric plastic and craniofacial surgeon. If your baby has a mild anomaly affecting only the external ear, sometimes we can do this non-surgically and mold it as a baby. But this can only be done in the first couple weeks of life. Surgical correction for older kids and adults can be done also, and it's not a time-dependent kind of thing. Just sort of whenever your child or you are bothered about the way your ear looks when you look in the mirror, you're all eligible for an otoplasty. Now, if a child is born with microtia or an underdeveloped ear, then this child really needs to be seen by a multidisciplinary craniofacial team. We need to get a hearing aid on him or her ASAP, and surgical correction can start as early as 5 years old. So thank you so much for your attention. My name is Dr. Justine Lee. You can email me if you have questions later on. I'm available on the UCLA homepage, uclahealth.org/Justine Lee. I'm available on Facebook, Twitter, LinkedIn, and Instagram. And I'll take your questions now. Okay, we have a question from Twitter. The question is, what feedback do patients give once they reach adult age regarding early life plastic manipulation? Well, I don't see too many patients come back far into adulthood. Usually, once the kids are done with their surgeries and their reconstruction is complete, not too many of them come back. I do, however, have a few of them. And mainly, it's how they feel about themselves. When they look in their mirror, are they happy and all that? And most of them are very happy that they were able to have the opportunity to have some reconstructive procedure to help them during their growing years. Okay, here's another question. Will my insurance cover an earwell procedure? Thankfully, yes. Your insurance will cover an earwell procedure. We've never had a problem with that. I think this is one of the things that insurance companies definitely had right, that this is something that we can do when babies are babies, and it saves them a surgery down the line. So yes, your insurance should cover earwell procedure, but you can always check with them. Again, I've never had a problem getting it covered. Okay. Can my child still undergo microtia surgery if they have a BAHA? Yes. So a BAHA is a bone-anchored hearing aid, and it's a surgical procedure. It's essentially, there's an implant that usually goes in the back of the head on the sort of prominence called the mastoid here, and that kind of replaces the headband hearing aid that one might see in some of these kids. And that hearing aid essentially just clips onto that implant. Your child can certainly have microtia surgery after the BAHA. My preference is if your child needs a BAHA, it's going to get a BAHA, rather have the child go through reconstruction first, because then we're not dealing with a lot of scarring when we're trying to implant cartilage in that area, and then we can get the BAHA afterwards. Okay. Now, will my insurance cover ear reconstruction procedures for microtia? What is the coverage for non-surgical procedures? So the non-surgical procedure, which is the earwell procedure that I showed you, ear molding, that's definitely covered. Microtia is definitely covered. Actually, the state of California, even for Medi-Cal patients, that diagnosis puts the patients in a special category that fits the California Children's Services category, for which all procedures related or all treatment related to microtia is completely covered by the state. And of course, private insurance will definitely cover these reconstructive procedures. All right, well, thank you so much for joining us today on the UCLA Health webinar series. Again, my name is Dr. Justine Lee. I'm happy to answer any questions you have even after the webinar is over. You have all my information, and hope to see you soon. Bye now.